It's Notes from No More Hygiene. Steve Anderson here with Dr. Tommy Nabors, and we are back on heart health, stroke victims, and what this really means for dentistry.
Exactly. We had the article presented last week on this very thing, and I wanted to do a part 2 on it because I think one of the things that people need to pay attention to when they're reading literature and research is who are the cited sources that are doing the article. And I think so many times in dentistry, it's a little bit more random, but when we have medical journals and physicians and chairs of departments of medical schools writing these articles and commenting on them, I really find it fascinating. It's something that we need to pay attention to.
Yeah, so it's and all of this is coming from the medical side. Not likely that anybody in dentistry would even come across this unless you're really plugged in. So just as a quick reminder, the research that we're referencing about the increased likelihood of a cardiovascular event following a stroke in patients that have periodontal disease, right?
Correct.
And this research is coming out of?
Well, it's coming out. I mean, it's called the Premier study. And this whole study, it was just released. It was a year-long study. It was published in Medscape and Medscape Cardiology. But there's a lot more information than we can go through here. But I think one of the people that we want to mention is that his name is Dr. Sin. He's an MD, MPH, professor of neurology at the University of South Carolina School of Medicine. And he said the whole take-home message from this whole Premier study is that periodontal treatment does impact cardiovascular outcomes in stroke patients. And he says that they initially tried to separate the periodontal patients into mild periodontal therapy or significant periodontal therapy, but there was so much periodontal disease they could not ethically separate the two groups.
Right. So you can't say you're not going to be treated. We're not going to let y'all get treated over here, but we're going to treat you guys and see the difference.
Right. And I just think it's important maybe to listen to what the physicians are saying. He said that I believe doctors that are treating stroke patients should advise that they pay particular attention to oral care and visit the dentist frequently for periodontal treatment if they have gum disease. And it is very unusual for people to get their regular dental cleaning. They don't understand that they need to do this. And so I think if physicians have that perception of people in general, 300 million people, that they're really not aware that they need to see the dentist regularly. And I know you talk all the time about how we think because we're in our organizations and have our colleagues and we have our groups that everybody must think dentistry is important. But I think the odds of how many people actually see the dentist regularly.
Well, and the other challenge with this, the other opportunity really is for a physician to say, do you see the dentist regularly, implies that you're getting everything done that needs to be done. And the reality of it, what we know is that 80% of the practices out there don't probe.
Right.
So that's the rest of the story. Obviously, those that are watching this are a cut above and they're very plugged into all of this. So just going to the dentist is not enough. You got to be going to the right dentist. So the opportunity here really is to reach out to the physicians in your area and give them a little education as well.
Absolutely.
Marketing opportunity.
And we're all looking for ways to educate our patients via social media, via in the office, and articles like this. When your patient hears an article that's coming from Medscape, that is coming from physicians, and it carries a lot of weight. And so I might just kind of finish my part on this by kind of one more quote. She said, I think the main take-home point of both groups that came in for dental visits had a much lower risk of another event than the group that did not show up for follow-up. And this was from Dr. McCullough. She's chair of the Department of Neurology at McGovern Medical School at the University of Texas Health Science Center.
Well, there you go.
Yes, Texas. She said, clearly seeing a provider made the difference. And she said, it is likely that contact with the dentist, getting blood pressure checked, et cetera, makes a dramatic difference. And so these are not just random medical schools. I mean, these are prestigious medical institutions, and they're now teaching that this is important.
Yeah. And if it's a medical school from Texas, you know it's good. Perfect. Thanks, Dr. Nabors. Again, groundbreaking science coming from the medical community. not widely circulated yet in dentistry. So if you're watching this, you're on the cutting edge, great opportunity not only to share with your team and your patients, but also with your local medical community. Get them plugged in about the difference between just going to the dentist and going to a practice that has a fully built out protocol like modular periodontal therapy that we teach in No More Hygiene, so that patients can actually get the disease cured, save their lives. One more evidence of this, and great benefits to everybody around. So thanks, Dr. Nabors, for the insight, the update, and the opportunity. Thanks for joining us, and we'll see you next time.
Appreciate it.